A 35-year-old pregnant woman comes to the clinic for her prenatal visit. The nurse gathers data about her obstetric history. She has a 3-year-old twins at home and had a miscarriage 10 years ago at 10 weeks gestation. How would the nurse accurately document this information? Gravida blank, para blank. The correct answer is Gravida 3, para 1. Rationally, gravida is a number of confirmed pregnancies, and each pregnancy is only counted one time, even if the pregnancy was a multiple gestation in case of twins or triplets. Para or parity indicates the total number of pregnancies that have reached the age of viability, which is 20 weeks, regardless of whether the infants were born alive. This woman who is now pregnant had 2 pregnancies and 1 viable birth, which is the twins. A client comes to the clinic for treatment of recurrent pelvic inflammatory disease. The nurse recognizes that this condition most frequently follows which type of infection? Option A, trichomoniasis. Option B, staphylococcus. Option C, chlamydia. Option D, streptococcus. The correct answer is option C, chlamydia. Rationally, chlamydial infections are one of the most frequent causes of salpingitis or pelvic inflammatory disease. Chlamydial bacteria could travel up toward the vagina or cervix into the reproductive organ. A nurse is to administer meperidine hydrochloride or Demerol 100 mg, atropine sulfate 0.4 mg, promethazine hydrochloride 50 mg IM to a preoperative client. List the order in which a nurse must carry out the following actions prior to the administration of preoperative medications. Option A, instruct the client to remain in bed. Option B, have the client empty the bladder. Option C, place the call monitor within reach. Option D, raise the side rails of the bed. The correct order is option B, to have the client empty the bladder. Then option A, instruct the client to remain in bed. Option D, raise the side rails of the bed. And then the last one is option C, place the call monitor within reach. Rationally, first have the client empty the bladder. Have the client urinate before administering preoperative medication. If the client does not have a catheter, it is important to empty the bladder before receiving preoperative medications to prevent bladder injury, specifically for pelvic surgeries. Otherwise, a straight catheter or an indwelling catheter may be ordered to make sure that the bladder is empty. Next is to instruct the client to remain in bed. Giving preoperative medications which can cause drowsiness and lightheadedness places a client at risk for injury. The next step is to raise the side rails of the bed to help prevent accidental falls and injury. And finally, place the call monitor within reach. It is an important device to help assist the patient whenever needed. Which individual is at the greatest risk of developing hypertension? Option A, a 45-year-old African American lawyer. Option B, a 60-year-old Asian American business owner. Option C, a 40-year-old Caucasian nurse. Option D, a 55-year-old Hispanic teacher. The correct answer is option A, a 45-year-old African American lawyer. Rationally, African Americans develop high blood pressure at younger ages than other groups in the U.S. Researchers have uncovered that African Americans respond differently to antihypertensive drugs than other groups of people. They are also found out to be more sensitive to salt, which increases the risk of developing hypertension. Which complication of cardiac catheterization should the nurse monitor for the initial 24 hours after the procedure? Option A, angina at rest. Option B, thrombus formation. Option C, dizziness. Option D, decrease in blood pressure. The correct answer is option B, thrombus formation. Rationale. A thrombus formation may prevent blood from flowing normally through the circulatory system, which may become an embolism and block the flow of blood towards major organs in the body. A nurse is administering a shot of vitamin K to a 30-day-old infant. Which of the following target areas is the most appropriate? Option A, gluteus maximus. Option B, gluteus minimus. Option C, vastus lateralis. Option D, vastus medialis. The correct answer is option C, vastus lateralis. Medications are injected into the bulkiest part of the vastus lateralis thigh muscle, which is the junction of the upper middle thirds of the muscle. Never give an injection in the gluteal muscles to avoid the risk of sciatica nerve damage. A parent calls the pediatric clinic and is worried about the bottle of cleaning fluid her child drank before 20 minutes. Which of the following is the most important instruction the nurse can give the parent? Option A, contact the poison control center immediately. Option B, this too shall pass. Option C, take the child immediately to the emergency department. Option D, give the child syrup of ipecac. The correct answer is option A, contact the poison control center immediately. Rationale. The Poison Control Center will have an exact plan of action for this child. Syrup of ipecac should not be given to someone who swallowed chemicals that cause burns on contact or medicines that can cause seizures very quickly. It can be dangerous to people with some types of medical problems. When such poisoning victims got ipecac anyway, they developed serious complications or even died. A 28-year-old diabetic male has been found wandering around in a confusing pattern. He is sweating and pale. Which of the following tests is most likely to be performed first? Option A, CT scan. Option B, blood glucose check. Option C, arterial blood gases. Option D, blood culture. The correct answer is option B, blood glucose check. Rationale. With a history of diabetes, the first response should be to check blood sugar levels. A patient is admitted to the same-day surgery unit for a liver biopsy. Which of the following laboratory tests assesses coagulation? Select all that apply. Option A, partial thromboplastin time. Option B, prothrombin time. Option C, platelet count. Option D, hemoglobin. The correct options are options A, B, and C. Rationale. Option A, the partial thromboplastin time, or PTT, also known as activated partial thromboplastin time, is a screening test that helps evaluate a person's ability to appropriately form blood clots. It measures the number of seconds it takes for a clot to form in a sample of blood after substances or reagents are added. Option B, prothrombin time, is a blood test that measures how long it takes blood to clot. A prothrombin time test can be used to check for bleeding problems and to check whether a coagulant medicine is working. Option C, platelets, also called thrombocytes, are tiny fragments of cells that are essential for normal blood clotting. They are formed from very large cells called megakaryocytes in the bone marrow and are released into the blood to circulate. A patient is admitted to the hospital with a diagnosis of primary hyperparathyroidism. A nurse checking the patient's lab results would expect which of the following changes in laboratory findings? Option A, elevated serum calcium. Option B, low serum parathyroid hormone. Option C, elevated serum vitamin D. Option D, low urine calcium. The correct answer is option A, elevated serum calcium. Rationale: the parathyroid glands regulate the calcium level in the blood. In hyperparathyroidism, the serum calcium will be elevated. The chronic excessive resorption of calcium from bone caused by excessive parathyroid hormone can result in osteopenia. Parathyroid hormone may be high or normal but not low.